I said to her, like, what the F, but and not that format. I said, what is that? And then my next question was, am I going to die? I was really scared because I don't think I'd really thought about mortality and like what I have and I don't want to lose. Hi, I'm Serena. I live in Columbus, Ohio, and I've been diagnosed with CLL, which is chronic lymphocytic leukemia. I'd had like a bunch of weird things just in my body that just felt off. Like I kept getting cramps in my legs that I kept getting, which then I was like, oh my gosh, am I a hypochondriac? Because I went to an ER because I have an IUD. And so I thought I was maybe getting like a blood clot or something because I kept getting these like knots all over my body. And they were just like, no, knots don't move. Things aren't going on. Like that doesn't happen. And that was like in the summer prior to me getting diagnosed. I was having like these weird like leg cramps and things. I kept having these terrible ovarian cramps. I thought that I was maybe having like a cyst because I had a lot of friends that had had cysts, like ovarian cysts, things like that. Um, and everyone just kept like, I went and got medical help because I was in a lot of pain. And basically, this urgent care that I went to that said that I might have some sort of mass or something that was internal. So they ended up sending me to my gynecologist, but at the time I didn't have great insurance. So I ended up having to go to the ER because my gynecologist actually deferred me because they didn't accept my insurance. They did an ultrasound, and it ended up being nothing. The only thing that came back weird was my white blood cell count was slightly elevated. So I didn't really feel well either. Like my complexion was really off. Like I kept getting these cramps. And another thing I noticed, which I didn't really relay later, was I was getting horrible hormonal acne. But it wasn't on my face. It was all on my chin. Like all of my chin was like breaking out and like I was just like, something is not correct. So basically, after this ER appointment where they did an internal external ultrasound, they referred me to a primary care, which I just moved back, so I didn't have one at the time. So we called a family friend who was a nurse practitioner. She ended up getting me in, and basically my white blood cell count kept coming back. And this process took 6 months for me eventually to get referred to a cancer hospital because my white blood cell count just kept being elevated. And especially since I was only 26, people were just like, you're kind of fine. Like there's something wrong, but you're kind of fine. Like, and that was kind of how that led into me seeking more help. So I had this health insurance that really didn't do a whole lot. To be honest. And that was a huge stressor for me. And also partially why this process took longer because I was like, people just keep telling me that nothing's wrong with me. I can't keep affording this. Like, which was a really real thing. Like I got a bill for the ER and it was like $5,000. And I was like, I physically like there's no way. um Things I was looking for though, it's just like I just knew something was wrong. Like I just knew that I didn't feel well. I was sleeping all the time. I kept getting these horrendous cramping that just like would not go away. Like I would like be dilapidated. Like I would like lay in bed all day with like a heating pad because if I moved, I was just in pain. So I didn't really know what answers I was seeking, but I was afraid. And I think I was afraid too because my brother had cancer at 22. He had Hodgkin's lymphoma and he fortunately beat it. I started having night sweats. That was like a huge thing. Like I would wake up and my head would be drenched because I just really felt off. And financially, it was really scary too. And the fact that like a lot of people, doctors included, were kind of gaslighting me. Even when I ended up going to one of the cancer hospitals, like when I was first getting diagnosed or when I was going through that with a hematologist, she literally even said to me, you're 26, you're pretty healthy. To get a blood cancer is only a 2% chance for anyone to get. And I really think you're in the 98% of things. And then just the uncertainty that's come with my age because there's just no research. And that's been such a weird learning curve for me because I've basically realized that I'm kind of a research study because there's no one else my age. So it's like any sort of pathway that they would be able to refer anyone to that's in the age range and the things that are being studied, they can actually give people referrals to do stuff. Me, because I don't fit anything, there's nothing. I was working like a career fair at some school and was driving back to my office, and I pulled into a Wendy's parking lot because I got my call from my doctor, and I was like, "Oh, like she's probably calling me to tell me I'm fine, which is great." And I was all chipper, honestly, because I was just like, "Hey, like basically, like this is gonna be good, whatever." And she was like, she honestly, her tone immediately made me not feel great. She was like, "Hey, Serena, do you have like a moment to talk?" And I was like, "Yeah, yeah, like what's up?" And she was like, "So we did get your blood results back." She was like, "So I'm calling you a day late because I actually had my coworker double check all of my work because I've never seen this in my entire career," which I can still feel the body feeling of like my stomach just dropped. Um, and she was like, "So you actually have a disease called chronic lymphocytic leukemia." And I remember just like even now, like I can like I don't know, the body doesn't forget how you feel in those moments. Um, like my chest really tightening and just being like, I said to her like, "What the f?" But and not that format. I said, "What is that?" And then my next question was, "Am I gonna die?" And basically, what she said back to me was, "So chronic lymphocytic leukemia is incurable but treatable." But I will say that the average age patient is 72. And so obviously I'm 26 at the time. And I'm like, so what does that mean? I got transferred to the James because that's when I got diagnosed with weight and watch. So basically, it took a month to get into the James. So it was like this really quick process. And then it like slowed down for a second. And we're there. And I'm again expecting that I'm going to get on chemo. Like, because my other doctor was like, "Yeah, we're probably going to have to start stuff soon because you're just young and there's like, we just don't want this to get worse, basically." So, but then I go to the James and they're like, "Your counts are great. Like, you're really doing okay." And basically, they were like, "So, for your disease, early treatment really doesn't do a whole lot." Like, it finds out that they're like early treatment really doesn't help with the disease. It really doesn't help the longevity of your life. So basically, we're going to put you on wait and watch. And I remember just being like, that is the weirdest thing. I was like, not only did I just get diagnosed with incurable cancer, but now I just have to wait and watch for it to get worse. Like, like it was just so anxiety ridden, and it's just such a weird thing because especially because I still wasn't feeling well and I was still experiencing symptoms. So I was like, so I just have to deal with this? Like I just have to wake up drenched in sweat like on a regular basis. Like it was just really, really bizarre. And I remember being grateful though, because in the first year I have to go to the James every 3 months. And that was really great. Also, the resources that the James gave me were incredible. They immediately got me in with a young adult cancer social worker who has been a godsend. She has been one of the biggest successes and biggest help that I've experienced because she has helped me get connected with the Leukemia and Lymphoma Foundation for grants. Also, she kind of just taught me like, sounds weird, but like how to cancer 101, like of like things to prep for your appointments. I'm so young, like, will I need treatment multiple times? What does treatment look like for me? Like, in what does remission mean for me? Like, that is something that still really confuses me because I'm like, if my cells aren't created properly, anyways, and like, I mean, I guess remission is just there's a lack of cancer in your body, but I'm like, mine's an incurable disease. So sometimes that like really confuses me. But I do find some hope. Like I do find a lot of hope. Like my hematologists are extremely optimistic that I'm not going to need treatment for a while, especially after my next surgery I had last year. I had 5 lymph nodes removed because we thought I was transforming into Richter's syndrome, which was horrifying, and that was a whole other experience of like, oh, what does my future look like now? Because I really thought I was going to die. But I would say overall, I'm optimistic. I think the science is really there, and my doctors are really on my team, and they really they were always really optimistic about my lifespan, because that was something I had a question on too, of like, I'm diagnosed at 26. Like, am I going to die in 20 years? Like, or am I going to die in 5? Or am I going to die when I'm 80? Like, which obviously none of them can answer that. I can't answer that. But what I found that works is more focusing on life than death, and focusing on what I have and what I can do and what I'm in control of, opposed to being afraid of dying. And obviously, those fears and those thoughts are still there, but like, being able to focus on the beauties and the things that I have really, really helped. Each year, the world's largest gathering of blood cancer and disease doctors and researchers takes place, and we're about to share some of the most groundbreaking highlights from that meeting, including insights about from the top CLL specialists, like the one you're about to hear from.
So, Jeff, I've been living many years with CLL. Some people who will watch this program are newly diagnosed. I went through all the stages you go through, and I'm sure you see it every day in your practice. What the hell is this? And I'm really scared. I have a blood cancer. Will my life be shorter? Am I going to die anytime soon? And please, doctor, what do you have that's effective to treat me? And if that doesn't work, do you have something else? Yeah. We're going to get into all that. But just at a high level, Jeff, how do you feel for today's patient? How do you feel for them?
Andrew, it's a great question. And I have a very large practice of CLL patients. I take care of about 400 CLL patients. And, with each of them, you meet them, many of them, I've been the one who's been their first doctor. That's sort of the nature of my practice. So, a lot of folks who I take care of, they're the ones who I'm their first contact with the medical system in terms of understanding CLL. And, I think what you highlight is something I see time and time again, which is, a very understandable fear patients come in with. It's very common, you say leukemia and you see the eyes widen, you can kind of see them sit up a little straighter, and what you recognize under there is just a great deal of distress that any cancer would cause. And I think that one of the things as a doc is figuring out how to measure out how to administer the most unique medicine we give, which is the medicine of hope. And how do you communicate that with patients in the midst of, some of the worst days of their lives where they're like, oh my God, I got this new cancer diagnosis. And I do reference quite frequently, there's a study done in the Italian group that showed, hey, if you're age 65 and above, the likelihood, or if you're age 65 and above diagnosed with CLL, they have demonstrated that you really can't measure a statistical impact on survival. That most patients are going to outlive their diagnosis, and I think that's a really optimistic message that most patients aren't going to pass away from their disease, and that bears out from my own experience. The number of patients that I can think of who die of complications of CLL is really a very small fraction. Even in my large CLL practice, only a small number, 2 or 3 per year, might that be the case. So a lot of it's communicating, hey, there's a lot that we have for you, and it's not the traditional chemotherapy you used to have. We've got targeted agents, immunotherapy, and so forth.
You already mentioned that sort of people aren't going to need chemo. We've got this whole class of medicines, BTK inhibitors, and even new generations of that we can talk about. So first of all, the approved therapies. You have quite an arsenal now, right? Where you can use drugs either by themselves or together, maybe for a bigger bang, right?
Right. I think the way I look at this is that there's 3 main classes of drug. You mentioned BTK inhibitors. I would add to that BCL2 inhibitors, and then I would add to that immunotherapy. I think the status of the field right now is trying to figure out what's the best combination, what's the best sequence, and those are the big questions shaping the field right now. But the good news is, of course, these drugs are FDA approved and they're available to patients. So those are the kind of core questions.
I'm sure there are patients listening and their head is spinning and they're saying, well, gee, the different BTKs or a next generation BTK, with or without venetoclax, with or without obinutuzumab. And I guess what I know is not all CLL patients are the same.
Yeah.
This is an individualized choice, right?
Yeah, absolutely. I mean that there are some patients where, uh, from the physician perspective, I'm like, oh, this is what we're doing, and then there are other patients who are super involved in their care and, want to be involved in the decision making. I think that's great. They should be. And there are times where a patient might have preferences, but I may have different preferences based upon how I'm thinking about that. And sometimes it's a matter of calling to attention some of the potential side effects in a certain circumstance. Maybe somebody wants to do fixed duration, but their kidneys are no good, or they've got really bulky disease, or various reasons why we might pick one over the other, or even just how we think about, if we're going to do this first, what do we do second? What's going to be third? And if we're going to pick this first, what's the patient going to look like 5 to 7 years from now when we might need to do the second therapy? So, you sort of have to almost kind of have a game plan in mind for somebody from the outset.
Yeah, that is really well said. Now, I want to back up for a minute. We got a number of questions from patients. One of them, and somebody was like me, I said I went 4.5 years without treatment. I felt pretty good. Then I started to develop some lymph nodes, and my white blood count, fueled by lymphocytes, got to about 283,000. My friend Dave wrote, I think he's like even higher than that. He hasn't had treatment and he feels fine. So when to start treatment for the new patient?
So for a patient who's climbing quite rapidly, what we talk about the lymphocyte doubling time, generally when that number is going up more than twofold in less than 6 months, that's our clue that we need to do something. But there are other reasons we might treat somebody. Bulky lymph nodes, if they start developing marrow dysfunction, they're getting anemic, or their platelets are starting to go down, those can be reasons. The one that does come up periodically is fatigue. Some patients have disabling fatigue. They might be 55 years old, they're not depressed, their thyroid's fine, they're not iron deficient, but boy, they can only go to work for 4 hours before they have to come home. So some patients with disabling fatigue, that's a reason to treat, but these are all pretty well spelled out in what we call the IWCLL criteria: rate of change, symptomatic bulky lymph nodes, marrow dysfunction, and then other. Those are the reasons we treat patients.
Some of the people on Facebook, for instance, are under 50 with CLL, and I know it's not the most common, but there are people like that, and they say, well, is my age of diagnosis, is that a bad thing? In other words, am I going to have a rougher time with CLL because I'm diagnosed younger? Will I not live as long? What do you tell a younger patient just based on their age?
Yeah, it's a great question. And, I like to think of these patients where, we have to plan not for the next 10 to 15 years, but for the next 30 years. And I think that to some degree, we really celebrate that we have a lot of these new tools to control the disease, but I think it is a reasonable question to say, can you use these tools to control it for twice as long or 3 times as long as somebody who's diagnosed, maybe somebody who's diagnosed at age 80, right? So it's a different, it sort of requires a different game plan. And yes, our therapies are just as effective in younger individuals as older individuals, and in some cases maybe even more effective in younger individuals. But I think it does require some thoughtfulness to, think about the fact that we need to come up with something that's going to keep this disease in control for quite a bit longer. Now, the other thing is I do think this field is moving so fast that, those tools that we'll be using 5 to 7 years from now, I may not even have conceived of at this point. And, we don't have a ton of time to talk about bispecific antibodies or, maybe other drug targets and so forth. But if somebody's diagnosed younger, I think it's fair to assume that there will be more tools in the tool shed down the road.
Probably just live as much as you can. Like, find something that brings you joy and focus on that. Because focusing on waiting and watching just makes you wait and watch even worse. It makes you really hyperfixate. I think with waiting and watching, like, definitely listen to your body too. Like, if you're feeling off, advocate for yourself with your doctor. Like, I know for myself, I really didn't realize the first year that I felt like shit the whole time. And I was not communicating that because I didn't realize that I was. Like, I didn't realize me going home and napping every day wasn't normal. I didn't realize me not making plans with my friends wasn't normal because I was tired. Like, and those were things that they told me to like look for as symptoms, but I didn't process that something was actually wrong with me, and that's how it was until I finally listened to my body and was like, something is not feeling correct. So I'd say trust your body, find something that brings you joy and do that. Like, it is way better to focus on living than dying, like I said, or even the fear of that. And you can do incredible things.